So we wanted to spend a little bit of time talking about our community vision project. We had our bond issue last year that we ran, and it didn't pass by just a narrow margin. We were about 200 votes short. So after we did that, we went back to the community and said, what is it about the project that we could do differently to gain your support? What are things that you liked in the project? What did you not like? And where the hospital's at, how can we improve? And so from there, we took that information, and we were going to have a community meeting, start a series of community meetings in March of 2020, and then COVID happened, and so we had to couldn't have those community meetings. But the board wanted to continue to move forward with looking at different options for the project, how we could maybe scale the project back, how we could look at different locations, we looked at several different options. And then the board, we came up with an option that the board approved recently, a resolution to go forward with a bond issue.
We had hired a professional, an architect, and then also somebody to help us as a middleman kind of thing, so that, because it's hard to, and all the COVID things that are going on, and so they came back with some other options for us, because we did want to listen to what the community had to say about how much this might cost. And so the board looked at that, and with input from the architect and everybody that, people that we'd talked to, people in the community, we think we've come up with a good option that's greatly reduced. And I think this is going to be a good thing. We really wanted to listen to the community and see what they needed. And as I have laughed before, 1949 does not look bad on a person, but it's not good on a building. And so if we can improve and present something to the community that they feel good about. Some of us are getting older, and we need these things. And so I feel good about what we've got.
So what we had identified previously as priorities, we know that our acute care wing is 1949. It needs to be upgraded for many, many reasons. And similarly with our operating rooms and our surgery department. And so those really were the priorities. And in doing so, creating space for that, we were able to repurpose the existing acute care wing and create 15 long-term care beds, which with no long-term care in the county, there's a projected 180-bed shortage for just Clicktack County population. And so this is a small way to be able to provide 15 beds to help meet those needs of our local community.
And as I understand it, that will be in what we have as acute care now, and then we're going to be building new beds for the acute care in the addition that we would put in.
So those new beds will just have updated space, technology needs that you have in 2020 medicine versus 1949. Right. So we looked at the location, and just by shifting that location to on the south side of the hospital, going off the emergency department east in kind of where the gravel area is, we're able to do 2 levels, so 12,000 square feet on which would be the second level on the main floor hospital site, and then 12,000 square feet in the first level, which would be shell space.
Just a shell.
Yeah.
And our original plan was we would do out the front of the hospital 2-story addition, and what we've come back with now is this 2-story, as you said, but down by where the old clinic was. And the rooms would be facing in onto the garden area that we've got right now, a grass area. But it would be a seamless, it would go right straight across. It looks, it would not look like an addition at all. I think originally it had been, that was a thought to have it there anyway. But so we've changed the location from 2 complete stories. We're talking about upper story would be OR and acute care beds, and then the downstairs would be a shell, because we have so many new things that we'd like to present to the community and that we know that people need.
So we were, in doing so, we were able to get the square footage we want, knowing that this is going to take us into the next 20 years.
Right.
But that shelf space we were able to achieve. So there's about a 35% savings. So originally this was proposed as at about a $20 million project, and now we have reduced it to $14,300,000. So it's a pretty significant reduction in cost. That translates to the taxpayer for a $200,000 house. That's about a $48 increase on what is currently being paid.
And then we had a shell space underneath, and that was used as storage and all kinds of things. And now we've turned that into our physical therapy and occupational therapy. So that has been, and we were able to pay for that out of other things. And so I think having that space there that we can use in the future, we've got all kinds of things we can, but we can come up with other grants and so forth on that at a later date.
Yeah, so right? One of our goals is to be able to identify, needs for that main floor area, which we've got some ideas. We, even originally in the prior project, looking at specialty clinic, outpatient services, infusion services, wound care, those types of outpatient. A lot of services are really moving more towards outpatient services, but by having this project completed and the community support for it, then we'll be able to show some matching funds as we go pursue other grant opportunities. So we have been successful in receiving some grants for prior projects. That match component is always really important, and so at this level of funding, we have tried to get some grants to help support even the original project, and they're looking for that matching component, and this will really help.
Backing from the community, and that this is a positive direction that we're going.
So there's a lot of projects that we want to continue. We look at community needs assessments. We get feedback from the community. What services can we offer? Our surgical services program is growing.
Right.
So we have general surgery. Dr. McGilvery is here. We're excited to have her. We have orthopedic, podiatry. We're hoping to have GYN added soon. We have pain management, all doing procedures, endoscopy in that surgery department space. And so as we add more with the need for that upgraded space and really, rooms that are available for these specialists is really important.
So what would be, when we looked at this, the Plan 1, or Plan 2 actually at this point, what would that upper story, what all would be in that upper story?
So acute care, we'd have 8 rooms.
Okay.
2 of those rooms could be double occupancy, but we've also identified the need, especially in this time of COVID, to have those as higher acuity, negative pressure rooms. So if we needed to, we could turn those into ICU rooms as we, if we couldn't get a patient out. But it's really important to have that additional space and just extra electrical, extra, the airflow in those rooms are really important. And so, and then we would have the surgery department on the other side with a couple of ORs, a procedure room, and pre-op and recovery. So the space that's required for that.
Because we have all these surgeons coming in and all these opportunities that, and as I said, some of us are getting older in the community and really appreciate not having to go to the Dalles or go to Portland or something. If we can do those kinds of things here, I think that's huge.
Well, it is, and this last year in January, we experienced what it's like not to have the OR space. Our OR was down for 6 weeks and had some repairs that had to be done, and there's the lost revenue from not doing the surgeries here. You have the crew, the OR staff, and all the surgeons, available to do the surgeries, and we're just not able to do it. So we really, the space is older space, and we're going to be confronted with that, more in the future. And so having a new space that we don't have to.
But we've got plans for the old space. I mean, it's not like we're not using that. That would be the long-term.
So in the acute care space that currently where we have patients stay in the hospital, we would have 15 long-term care beds. In the existing surgery space, we would, there's a number of different types of services we could put in there. So for now, if the shell space on the first floor isn't finished, then we'll have to have a place for respiratory therapy, infusion services, wound care. So we'll be able to utilize the space, and then as more gets completed, we can kind of shuffle things around. And I think it's important in this time with COVID to think things through a little bit differently. That we've now have seen the importance of really separating people, having not as many people run through the same registration space, really separating the populations. And so I think that, pulling those outpatient services out of the heart of the hospital will help, in the future. We don't know what's to come with that.
Right. But we are trying to be good stewards of, fiscal responsibility and addressing, but getting this down to, I think, what people in Goldendale are going to need and would appreciate. I mean, I have had to go all the way to Portland, and then my daughter has to take off 2 days of work to be there with me, and it's just, it's not handy at all. And if we can do these things here.
The need has not gone away.
No.
COVID has happened and it's had its impact on our community, but the need for healthcare has not gone away. And not everybody has access to transportation or has the family support to get those services out of town. So being able to provide that, much needed service locally is really important.
So as we look at what we ended up with, we do want the community to know. We listened to you, and we do understand the kinds of things that you were concerned about. I've, on the upper floor that we're talking about, we're just looking at new acute care rooms, the 2 rooms that Leslie was talking about that could be specialized. The 2 ORs and a recovery room, because we've got all of these great surgeons coming in and all these opportunities that we have. But we did hear what you said, and we've eliminated some of the non-essential things that you felt were non-essential, that the gift shop, we did not expand the pharmacy. The dietary was to be expanded, and we've put that on hold too. So we do want people to understand that, we do listen to you. We did understand what was going on, and this is the direction that we've come, and we do hope that people understand and see what a great opportunity for the community we have in offering this to Clickitat County.
Just as a reminder to folks, if you're not aware that we do, if you have a bill at the hospital, the property tax that you do pay on your property tax statement that is attributed to the hospital, and there's a couple lines specifically for maintenance and operations and for a bond. That can be applied to your hospital bill. So, if this is an increase for you, if you're paying property tax and you're receiving services here, that can be applied, and so that's a way to offset that additional cost. We know that money's tight for everyone, and so this has been a benefit that's been available to our community members for several years now, and we'd like to see more people take advantage of it.
Right, and because I didn't know about that either.
So Connie, the other feedback that we got from the community was, in areas that we can improve at the hospital. And one of the concerns that was brought up is we were having to utilize locums in our emergency department. So the physicians, we had several different physicians coming through, quality physicians, but they weren't consistent. And so since then, we've been able to recruit some local physicians that are living in Goldendale now and really have a core group. So we are not having to utilize locums now in the emergency department. I've had a lot of really positive feedback from the community on the service that's being provided. So we're excited to kind of get to that level and offer that. The other thing that we heard pretty consistently was just some frustrations over our electronic health record and the impact on billing. And so we had initiated the process to start searching for a new electronic health record. We have 5 main health records that we utilize here, which is a lot. Yeah. And the impact of that is not having one record that you can go into a patient portal and get your information, but it also has an impact impact on billing because they're trying to pull those 5 different
Right.
softwares together to bill from. And so we went through the search, and the board approved moving forward, making a decision that we are going to start the implementation process in January. So that's going to take a while, and that things won't be
Right.
perfect for a while, but definitely it's going to be an improvement from both the patient record side, one patient, one record, and then from the billing side. So those are 2 pretty significant ones. In the meantime, we've also added to our behavioral health services, which has been great service, especially during this time of COVID, because of just the whole mental health component of it, as well as dental started in October. We're not competing with the local dentists. We've been really our focus has been entirely on the Medicaid population who has not received dental services for many years,
and that actually saves money in the long run, because if they can proactively get things repaired before they get really sick and have to go into the emergency room, then that doesn't make sense to do that way.
Right. And I mean, this is really a whole sort of pilot project with the state, because they recognize that if we can address these dental oral health issues, the total cost of care of the patient's going to go down in the long run.
Right.
So we've been working with the state specifically on that program, and we're really excited to see how well it's done. Dr. Furch and Kristen Chambers have done an amazing job, and so we've really helped a lot of people.
That's good.
So I'm sure there are people in the community that are wondering, why now? Why in the middle of COVID and the economic impact of what has happened, why is the hospital district going forward with this now? And I think, the need has not gone away. We know that construction inflation historically has been between 3% and 5%, and even with this new project, that the estimates have that built-in increase of another year. That every year that we put this off, it's adding at least another $500,000 to the project, and eventually, we have to get it done. Our facility is not going to last forever, and then we have to make a decision of what services do we want to offer. But we will. It is a challenging environment. We're watching what's going on with the county, with unemployment rates, with how businesses are impacted, and are really sensitive to that. And but in the midst of all this, healthcare continues. And
we have to upgrade. We have to keep it at least where we are. I mean, we've got to go on from there. I have to go forward. So,
and it is challenging, and we recognize that. And I think going back and decreasing the cost of the project by 35% to say, we're sensitive to that. We're hoping to find alternative funding sources to make up that difference in grant funds, in loans that the hospital pays for separately outside of this bond. So as we move forward in the future, one thing that this project does, and we identified previously, adding long-term care, the FTEs, those jobs that are created. So there's additional economic impact in a positive way by the construction, the actual construction, when you're doing $10 million in construction, and those people that are employed for that project. And then the additional employees after the project's complete. So we're continuing to add to the economic, to the economy, our local economy, which is a positive impact.
How many people do we employ full-time?
We have roughly about 200 FTEs. This project, we anticipated before, would add about, I think, 22, the total number of additional FTEs. So, I think that definitely we went through the process of, and this is what the economic impact gets multiplied of those jobs that are created, and a significant portion of our employees live in our community, or live in Klickitat County. It's I think it was like 90%, so a very high percent, and so that's going straight back to Klickitat County.
Right.
The hospital district's construction project will be on the ballot in the November general election, and we wanted to be able to provide some information about that, about why the board decided to go forward with this proposition, how that is different from the last one, and We'll have much more information in the months to come. Information will be on our website. I'm available, and the
My
board
number is in the book.
Yeah, the board is always really accessible and wants
Right.
to get feedback
Right.
from the community. So
All 5 of us, yeah.
we'll be looking for more feedback,
Mhm.
and but we just wanted to give you a heads up that it will be on the ballot.
That we've listened and we've reduced things and feel good, though, about the direction that we're looking at.